Constipation is not just reduced bowel frequency, it is a failure of multiple physiological mechanisms. And unless you understand which mechanism is failing, you cannot manage it effectively. So, what exactly is constipation? It is defined as persistent, difficult, infrequent, or seemingly incomplete defecation. Now, one more point: normal bowel frequency varies widely. So, constipation is subjective, and frequency alone does not define it. For clinical diagnosis and for exams, Rome's 4 criteria is essential. You need at least 2 of the following: less than 3 bowel movements per week, hard stools, incomplete evacuation, difficult straining, and symptoms for at least 3 months in the absence of IBS. So I've given this acronym 3 HARDs, so it will be very easy for you to remember. Now coming to the most important part, the most difficult and the confusing part, that is the pathophysiology. The first, slow transit. The movement itself slows down. So reduced colonic motility prolongs the transit time of the stool in the colon, which leads to more and more water absorption, which leads to hard stools. Next is the pelvic floor dysfunction. So here the stool reaches the outlet, but it cannot pass effectively due to pelvic floor muscles dysfunction, which create a functional obstruction. Third, dyssynergic defecation. Here the coordination fails, the abdominal push and the pelvic floor relaxation. They do not occur together, resulting in ineffective evacuation. Fourth, the rectal hyposensitivity. The problem here is a sensory. The rectum fills, but the urge is reduced. So the patient does not feel the need to defecate. And finally, neural control. Disruption in signaling between the brain and the gut. It leads to a poor coordination and weak motility. So constipation is not one disease, but multiple physiological failures. Now coming to the classification, it is broadly classified into primary and secondary types. In primary or functional constipation, the first type is normal transit. The perception problems, the patient perceives difficulty in passing stool, and it usually gets better with adequate fiber and fluid. The second, slow transit. Here there is a delayed movement of stool through the colon, which leads to reduced colonic motility, which we have studied. And the third, the defecatory disorder, again which we have studied, the impaired coordination of pelvic floor muscles or other structural issues. It prevents effective evacuation. Now coming to the secondary constipation, following are the causes. First is metabolic, second is neurological, the third is structural, and fourth is drug induced. Always rule out secondary causes first and then go to the primary causes. Now the signs and symptoms. Clinically, patients presents with these characteristic symptoms: infrequent bowel movements, excessive straining, hard or lumpy stools, and a sensation of incomplete evacuation. There may also be complaint of bloating, abdominal discomfort, and a feeling of anorectal blockage. So remember, constipation is not just about frequency, not just about hard stool or straining. It is about movement, coordination, sensation, and control. Thank you.